Hello, welcome to any community. In this particular video, we are going to solve one particular puzzle. In this particular video, we are going to see one particular description of one particular patient. So what we need to do, we have to identify the disease that particular individual is suffering from. The description goes like this: 35-year-old female coming to your clinic on one particular evening. She is presented with certain sets of the presenting complaints. Suddenly, you notice the there is a deformity in the uh, both upper limbs, like the show in this particular image. What might be the probable disease that 35-year-old lady may be suffering from? Answer this particular uh, scenario. Pause the video. As far as the description, the 35-year-old female having this particular deformity observed in both upper limbs. The the disease the person may be suffering from, that is considered to be rheumatoid arthritis. When you think about the rheumatoid arthritis, these are the certain deformities that may be observed in the person who is suffering from rheumatoid arthritis, wherein the person will be having the duration of the illness of a long duration, that is chronic illness as such, wherein smaller joint affliction that will be observed and symmetrical joint affliction that may be observed, that will be associated with the morning stiffness and the swan neck deformity. So here the middle finger and ring finger and even the little finger of the right hand, that is having the swan neck deformity. So that is the flexion of a distal interphalangeal joint and hyperextension of a proximal interphalangeal joint. That is considered to be swan neck deformity. Wherein bottom-ear deformity, where there will be the exactly the opposite aspect that will be observed. So that is the flexion of proximal interphalangeal joint and the uh, hyper extension of the distal interphalangeal joint, that is bottom-ear deformity that may be seen. But in this particular occasion, that is not being present. And Z deformity, that is the Z deformity, definitely that is observed in the thumb. Here, that is the left thumb, there is Z deformity. And subluxation of a metacarpophalangeal joint. Subluxation in the sense that is the partial dislocation that is being observed in both the upper limbs, the two metacarpophalangeal joints that are being observed. And when you think about the description, the most of these particular description that mimics the lakshana that is being mentioned in the context of amavata. And when you think about the amavata, so the four major keywords one has to remember, that is viruddha ahara, mandagni, snigdha ahara, and vyayama. So that means the person is going to consume incompatible food substances. The mandagni, the person will be having poor digestive function. Snigdha ahara, the person is going to take excess amount of the unctuous food substances. And vyayama, the person is doing the activity, excessive activity in that particular situation. So that is considered to be the main keywords that actually are being described in the context of Amavata. As far as Amavata and Rogamarga is concerned, when you think about the Viruddha Ahara, so definitely that is considered to be incompatible food substances, wherein there may be a possibility of alimentary canal dysfunction. Because of Viruddha Ahara, there may be a possibility of inflammation in the stomach or small intestine or large intestine. Snigdha Ahara, when the person is going to consume excess amount of the snigdha ahara or antioxidant substances, they are considered to be responsible for the poor digestive activity. Third aspect, that is the mandagni. Already the person is having the, because of the viruddha ahara and snigdha ahara, there will be mandagni, but the this is a specific state wherein the person will be having the poor digestive function itself, which in turn there will be the affliction of alimentary canal, or what do we say, that the abhyantara rogamarga. So that is being afflicted. And when the person is doing more amount of the activity, so these particular the macromolecules, what we can say, they are being present either in the stomach or in the small intestine or in the large intestine, that start entering into the intravascular compartment, what we can say the rasadhatu, and later that will be entering into the intravascular compartment of the joints, because the person is doing more amount of the activity of the specifically because of the activities, the more and more amount of the blood supply will be there towards the limbs, where the more and more amount of the activity is being taking place. After that, these macromolecules, they start entering into the interstitial compartment of the joints, and later there will be the affliction of the intracellular compartment of the joints. In that way, Bahya Roga Marga and Madhyama Roga Marga, that will be afflicted. So when you think about the description of rheumatoid arthritis, we are going to what do you say, that we are going to uh, what do you say, that equate with the description available in the context of Amavata. And when you think about the Roga Marga affliction, initially there may be a possibility of the Abhyantara Roga Marga affliction because of the alimentary canal dysfunction, or what we can say the Mahasrota dysfunction, and later there may be the possibility of affliction of Bahya Roga Marga as well as the Madhyama Roga Marga. Thus, this particular disease, if it is present chronic, it is considered to be a little bit difficult to cure. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you like to hear in the coming days in this particular channel? Mention in this particular comment box below, and spread this particular video to maximum number of true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.